Assalamualaikum warahmatullahi wabarakatuh. Hello everybody, I want to say thank you for coming my video. My name is Yabrianti Rizkina Putri, name 019. I am from Health Polytechnic Ministry of Semarang. I'd like to give you a presentation and talk you into discussing about Angelman syndrome. I'll explain the definition of Angelman syndrome, the sign and symptom of Angelman syndrome, the treatment of Angelman syndrome, curable or not, and data about Angelman syndrome. 1. Definition. What is Angelman syndrome? Angelman syndrome is a complex genetic disorder that affects the nervous system, causing developmental delays, both physical and intellectual. For example, developmental delays, difficulty speaking, seizures and balance disorder, and difficulty walking. Angelman syndrome is caused by a gene mutation that occurs before the baby is born, causing an abnormality on chromosome 15. Angelman syndrome is rare disease. Topic 2. Sign and symptoms. 1. Ataxia. Ataxia is a disorder in the form of a lack of coordination between body parts. Children with Angelman syndrome generally have difficulty making movements that require coordination of several body parts. For example, taking things, holding on chairs, walking, even chewing and swallowing food. 3. Scoliosis. Most sufferers also have a side curved spine called scoliosis. One visible sign is the stark difference in the height of the right and left shoulders. 4. Strabismus. This phenomenon occurs because the muscles around the eyes are weakened so that the position of the eyeballs is not parallel. 5. Growth and development disorder. Even though they can live to adulthood, developmental disorder occurs in children with this syndrome. Usually, children have seizures when they are a few months old. Number 6. Rigid limb. Most babies suffer from stiffness in all four limbs due to excess muscle to strain that area. As they get older, children with Angelman syndrome become less excited. However, children's sleep disorders usually tend to improve. Children with Angelman syndrome will usually still have intellectual problems, severe speech problems, and seizures. Other symptoms of Angelman syndrome are like skin and hair color. Topic 3. Treatment. Since there is no way to correct a chromosomal defect, there is no cure for Angelman syndrome. Treatment focuses on managing medical and developmental problems caused by chromosomal defect. 1. Anti-seizure drug. Medication may be needed to control seizures caused by Angelman syndrome. 2. Physical therapy. Children with Angelman syndrome can learn to walk better and cope with other movement problems with the help of physical therapy. 3. Communication therapy. Although people with Angelman syndrome usually lack verbal skills with simple sentences, they can communicate. Communication therapy can help nonverbal language skills can be developed through sign language and image communication. 4. Behavioral therapy. Behavioral therapy can help children with Angelman syndrome deal with hyperactive and short attention span, which can aid in developmental progress Although the level of development of people with Angelman syndrome can vary, many are outgoing and able to build relationships with friends and family. Tapi for credible or not? Actually, there is no treatment that can really cure Angelman syndrome, but being able to provide care for children that are to treat medical problems, monitor their development, and relieve symptoms can help the child development get better. Treatment for Angelman syndrome usually depend on the signs and symptoms you are experiencing. Topic 5. Data about Angelman syndrome. Angelman syndrome is a term used to describe a genetic condition that affects the nervous system and causes physical and intellectual disabilities. It is estimated that this condition occurs in 1 every 15,000 lives lived. Angelman syndrome sufferers have a life expectancy that is approximately the same as the normal population. However, sufferers of this syndrome need lifelong help to themselves.
So the explanation for me. If you have any question, you are free to ask about this topic in the comment column. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.